Filipino American Cancer Care now brings you On the Air with FACC, tributes and support to those impacted by cancer. On the Air with FACC, the Filipino American Cancer Care on PHLV Radio.
Good evening, ladies and gentlemen. Magandang gabi sa inyong lahat dito sa Amerika. Good evening and of course, magandang umaga Pilipinas. Good morning Philippines. I'm Josie Moralidad Zayman from the Filipino American Cancer Care. And of course, we are live on PHLV Radio in Las Vegas. I had to put on a timer. Just want to make sure that we have, enough time for this interview this evening. And of course, we would like to acknowledge our station manager on PHLV Radio in Las Vegas, Mr. Johan. Thank you so much for being with us on every Friday dito po and on the air with FACC, Filipino American Cancer Care. And thank you for all the attendees of the cooking class with French Master Chef Evelyn Bunuan. It's a cooking class fundraising event and of course sa ating mga beneficiaries and our upcoming, the biggest fundraising event of the Filipino American Cancer Care is going to be on Sunday, October 12, 2025 at 3 p.m. Okay? We're going to have probably 15 to 25 cancer patient beneficiaries. Each one of them will receive $1,000 as financial assistance. This is the biggest fundraising event of the Filipino American Cancer Care. And if you are interested to sponsor or become a model, in the fashion show, please give us a call or text us at 571-352-0165. Or you can email us at info@filmcancercare.org or message us on our Facebook account or, of course, Instagram. Now, our special guest tonight is a medical doctor with 3 American boards with a deep passion for holistic wellness from adolescence to maturity. She was born and raised in Colombia. She studied medicine at the University of Rosario in Bogota, and she completed her internship year at McGill University in Montreal. Wow. And continued with a 3 years residency at Lincoln Hospital associated with Will Cornell College in New York City, where she graduated in pediatrics and adolescent medicine. She continued her specialized education in Canada, graduating at the University of Montreal. In 2021, she obtained her diploma from the American College of Lifestyle Medicine, followed by the board certification in obesity and metabolic diseases, and subsequently obtained her certificate in menopause by the NAMS, now known as the Menopause Society, in 2022 after grappling with the challenges of a broken healthcare system and nearly stepping away from her calling. She found renewed purpose through lifestyle medicine. And as a board certified lifestyle medicine physician, she brings a comprehensive and evidence-based approach to cancer care, addressing prevention, supporting patients during treatment, and empowering survivors to maintain long-term wellness. And grounded in the 6 pillars of lifestyle medicine: nutrition, physical activity, restorative sleep, stress management, healthy relationships, and avoidance of risky substances. Lifestyle medicine guides individuals in making sustainable lifestyle changes that can profoundly impact cancer outcomes. Now, ladies and gentlemen, please welcome Dr. Paola D'Aleman. Hi, Doc. Good evening to all our viewers, listeners, and supporters here in the United States, and good morning in the Philippines, and of course, to all our followers all over the United States. Or, anywhere, because now we're live on Facebook, in YouTube, Spotify, and Amazon Fire.
Fantastic. We are covering the globe, Josie.
Yes,
Thank
that's the
you so
magic
much.
of digital
It
media.
is. Thank you, to your beautiful foundation. I loved the fact that the Filipino American Cancer Care got together and they have a voice through you. I appreciate this invitation. Thank you for the introduction. And I am here to be part of the team. We all together can get a lot of knowledge on prevention, and that means that can be reflected in that we can avert or improve our lives when we speak about cancer. So thank you
You
again.
look very healthy.
Thank you. I try to.
What's your typical day? Because being a doctor, it's a busy career, and we only have 24 hours a day. Just like me, I'm too busy. But sometimes I don't have time to exercise, to do something else. Because, there's so many things you have to accomplish even in this organization alone.
Absolutely. And time has been always one of these assets that we all have, and that we always say that what we don't have is time. But I think everything starts with priorities, and recognize that self-care and well-being, it should be on your top one. There is nothing the most expensive asset that you can have, the most precious thing that you can have, it is your health. Nothing else will replace that.
What
Everything else
is your
is
typical day as a doctor?
Okay, so as a doctor, especially now, since I change my way, I reinvent my way of practicing medicine, like you mentioned it, after COVID, I was one of these physicians who was like a frontliner and got tired of not only obviously the epidemic that we had to go through, but how the system was working. And I had to re-question everything, always with the priority that self-care was the most important. So I reinvented everything that I could practice medicine in a way that I could take care of myself and take care of my patients. Because like, in an airplane, the first thing that you do is you put the oxygen mask on yourself before you help others. So this was my motto and my approach to medicine. So for the past 4 years, I would say, I'm a big believer of habits. So I created some habits. I wake up in the morning, my typical day, and I'm talking about Monday through Saturday because I sleep in on Sundays. I wake up early enough that I have an hour and a half to 2 hours in the morning just for myself. I wake up very slow and I do yoga every morning and I do meditation every morning. And after that, I just take care of myself with lime water, my probiotics, and then I have a cup of black coffee. And that's my morning. I arrive to the office and I have some days that I do resistance exercising, which is just twice a week
Yeah.
in the morning.
Keep talking, Doc, because I'm going to turn on my light. I'm too dark on this video right now. Yeah, I'm
Okay,
gonna be
yes,
listening.
go ahead, go ahead. So after exercising, and then sometimes 2 days of the week, I'll do it in the afternoon, but I really try to exercise at least 4 times a week during my day at the office. Either going outside for a walk, and I'm very precise on how fast I walk and how my heart rate goes. I claim myself to do precision medicine, so it's like exercising with a purpose. And same thing for when I do my nutrition. So I don't have to think a lot about my nutrition, but I do prep, and I prep on Sundays mainly when I have to go to the supermarket, and I kind of grab and pack things that it will help me through the week. So I don't have to think too much about how am I going to eat well, lunch or dinner. So
Yeah.
all this goes Monday through Saturday. Sunday, I let it go. I sleep in. Then I go to the farmer's market, try to make it fun and create my routine for the week. Of
Mhm.
course, I break the rules.
Did
Of
you
course,
have
there
do
is.
you have kids?
Yes, I do. I do have two kids, but they are already in university. One is in high school and the other one is in university. So they're pretty self-dependent. So it's true. We have to be sustainable here. And whoever is listening to us and saying, sure, you don't have kids at home, that I have all my time is devoted to them.
Mhm.
And I get it. And I understand because I was there. And it requires a full village to help you raise your kids.
Yeah.
But when time can be manipulated in a way that with practical little steps, you can create an environment that it can be healthy
Mhm.
for you
Yeah.
based on these six
So
pillars that
what
you.
inspired you to become a medical doctor?
So what inspired
Did you
me?
come from
Oh,
a family of doctors?
no, I'm actually the only physician in the family. Yes. So this is a question that it took me by surprise. I wasn't expecting that, but right from since I was a child, I wanted to become a veterinarian. I love animals, and I'm like, this is so cute. I want to be a veterinarian. Unfortunately, I grew up in Colombia in 1970s, 80s, and 90s when it was a lot of the drug lords there, and I
Mm-hmm.
was a victim of a gunshot.
Oh,
So
wow.
so I was very young. I was 9, and I was very lucky. And but some people die around me when I was shot. And in that process, I had to be put through a lot of pathologists and criminal specialists
Yeah.
and psychologists specialized in children. And I actually got a lot of support from these people. And you won't believe me, but I think that totally motivated me to be like them. I'm like, I'm loving this. This is what you do in life? This is how you help people? And not only from the moment that they have to basically take away a bullet out of one hand, and I had another like bullet that it totally touched my head, but it didn't go inside. It was quite of a spectacular, dramatic story that I don't want to get in there. But it's the people that surround me during that moment and gave me all the support, kind of
Mm-hmm.
inspire me. And I never made the connection until later when I was I think I was doing residency and someone mentioned it and I said, yeah, sure, I'm an overachiever. So I wanted to be a doctor because doctors always are prestigious. And then he said, I don't know, I think the whole story of you being a victim of a gunshot when you were a kid in Colombia might gonna play a role on it. And in retrospect, and obviously I've been doing therapy before, so I can kind of go back in time and say, maybe that play a big motivation on why I
Mm-hmm.
decided to be a physician. Obviously, this
Yeah.
comes with a little bit of personality. We physicians, most of us, we're more generous with our time, with our services, what we want to do. It is beyond of whatever prestigious. Anyways, medicine is not prestigious anymore. The system, the system is not making medicine prestigious anymore. The patients, they don't trust us anymore. So
Uh-huh.
I'm not, this is not a
But
place to go
you
to.
were trained in Colombia and North America. And
Yes.
how did that shape your approach to medicine?
Correct. I think I was very lucky to have the best of two worlds. Being Colombia, a third world country, but still having a lot of resources, and there is because we don't have the extra technology. A lot of things, and
You
I'm
have the
talking about
best
19.
doctors, just like Philippines. We have the best nurses
Exactly.
and doctors, but we don't have that
Absolutely.
advanced technology and resources.
Correct. So exactly this is how because I had to be in contact with a lot of people from different countries. And
Mm-hmm.
Philippines is one of the big countries that produces a lot of health providers and fantastic health providers. I can make that reflection. You're totally right. So we all kind of learn to work with our hands and our nails. And
Mm-hmm.
I believe that we had a better clinical eye and a better
Mm-hmm.
a better judgment just with the fact that we didn't have to rely on any technology. Of course, right now our countries have the technology, but I'm talking about by the time and I was taught in profound, like deep, and I had to go to medical school for 6 years. When I arrived to McGill, they were only medical school for 3-4 years. They were not hands-on. I already did appendectomies by them. They were like, wow, what are you doing? I said, well, it is a need, and we're well supervised. Many people in very developed countries think that because we were in underdeveloped countries, we were just doing whatever we wanted and we were cowboys there. But it's not true. We were well supervised and everybody's true. Then the needs are higher, the population is less income. So we were trying to cover more underserved areas. So we had a practice, our experience, it was huge. Once I arrived to Canada, I have to say that I impressed them somehow with my skills. But on the other side, I noticed that their knowledge in regards to what's the latest research and the latest, let's say, evidence base that it was written, they were able to have access to that more than we were, just because we're not talking about the internet was available at that time. So it was whatever was in our libraries. So everything that I learned in North America, it was the latest thing, right? Everything and I learned how to do research and how to produce papers and how that was so important for this community because it was the only way that we can continue evolving in medicine. So I got the best of two worlds. I got my skills and I think my bedside manners come a lot from my third world country growing up as a doctor.
From your culture.
I call myself like a warrior doctor. We were a warrior doctor.
That's right.
And his eye contact and his things. And of course I have to document. But here you have to document because you have to be careful with the lawyers and the malpractice and the insurance wants documentation. So the shift, everything shift versus the medicine of 1990s and the early 2000s was about the patient. And I think we should go back there. Patient focus.
So before we talk about lifestyle medicine, what led you to focus on holistic wellness and lifestyle medicine, especially after working in what you called as traditional medicine?
Correct. So I'm still want to portray myself as a traditional doctor because the problem is medicine has been looking for too many outlets, and there is so many people out there saying that they are practicing medicine, but then you cannot exactly pinpoint what kind of medicine is. So I consider myself a traditional doctor. I was trained traditional. I do believe in traditional medicine. I think the pharmaceutical companies have a place. I understand we've been abusing them, and I understand there is lobbying and business behind, but there is a place for it. But on the other side, traditional allopathic medicine has forgotten that our organism is the perfect machine and it has the power of self-healing. But the problem is we lost that, not only that thought, but the knowledge. And if we divided the Western medicine and the Eastern medicine, Eastern medicine is still never let go the knowledge that the body is smart, is intelligent, and it has a lot of potential to self-heal if we give them the right tools. That knowledge of the right tools on what to eat and how to move, because we don't want to call it exercise because exercise doesn't mean being in a gym for 2 hours. I'm talking about movement, walking, mindfulness, walking on the park for 10 minutes. All these will have an impact in
But by the way, who motivated you and how did you discover about lifestyle medicine, being, of course, part of the healthcare industry?
Yes. So this was a very unique moment at 2 a.m. in the morning when they called me for an emergency C-section to be present. And I walk into that C-section and I told everybody that day, I think I'm burned out and this is the last C-section I'm going to do in my life. I'm in medicine and I am going to become a yoga teacher because yoga makes me happy. And this is not. This is 2 a.m. in the morning and you need a pediatrician just to hold the baby back, but you don't even need me. You just need to charge the insurance. So I'm done.
Insurance is making a lot of money.
Yes. that's a total new episode we
Yeah.
can do together,
And
Josie.
it's becoming a business
It
in the
is a business.
healthcare
So
industry.
one of the physicians there said to me, "No, don't go anywhere. I'll talk to you after we finish the C-section." She was
Mm-hmm.
fantastic, and she said, "I want to invite you to a conference where they can empower you." So she brought me to a conference that is only women's conference. It's called Pinnacle, and it's only women get together. They are physicians. They get together, and they can. And I didn't want to. I said, there is just going to be all these women, most probably just like ventilating about the way how they don't get paid as much as their counterpart male. I'm not sure I want to go. But when I went there and I saw these women, I noticed that they were all reinventing themselves in medicine from all different fields, from
Mm-hmm.
orthopedics to
That's
gastroenterology, the
right.
psychologists, and everybody had this lifestyle medicine board behind them.
Mm-hmm.
So I'm like listening to them. Thanks God for Google. I pick my phone and I said, lifestyle medicine. What's that? Oh, that's a
Mm-hmm.
specialty, but that's a specialty that was invented by woo. No. This is a real specialty in medicine from traditional medicine
Can
that
you
it has
also
been
call
for time.
this as alternative medicine?
No, there is a difference. There is a difference between alternative medicine. Alternative medicine gives you an alternative way to the allopathic. Allopathic means traditional medicine.
Okay.
Lifestyle medicine belongs to traditional medicine.
Okay.
Lifestyle medicine is closer to functional medicine.
Okay.
Functional medicine treats the root cause. And
Mm-hmm.
that's beautiful. That base is beautiful. But the thing is, many things that functional medicine does, unfortunately, they don't have the science back 100% out of research. So that's why lifestyle medicine doesn't want to be seen as functional medicine. Lifestyle medicine practices have all the research behind
Mm-hmm.
and the evidence base. That's why they are American board. They're
Yeah.
called the American College of Lifestyle Medicine. And right now they are doing a residency on it. So you can come from medical school directly.
Wow.
And
Mm-hmm.
once you become a lifestyle medicine, obviously there is something like acute, almost like a ICU lifestyle medicine, which is fantastic. You can have people hospitalized for
Mm-hmm.
certain months to create the perfect environment to go
Mm-hmm.
back into their
And
perfect
in your
metabolic.
case, as a doctor, you're also practicing it for
Correct.
yourself.
So let's absolutely. Well, I have to practice on me what I'm trying to portray to others, right? So
Mm-hmm.
I do it as an outpatient. I don't do it as an acute center like many
Yeah.
other centers they are opening, but I practice by I don't want to say the rules, but their baseline, right? So
Mm-hmm.
it's a lot of things that have been proven, what type of nutrition and how the movement will change and how the stress has to be managed. Now,
Okay. Yeah.
it it has to be a little. It was created in Loma Linda in California, and it has a lot to do with the blue zones, and their nutrition is very based in plant based. So many of the lifestyle medicine doctors that are a little bit like very strict, they are plant-based 100%. I do believe that it has to be a flexibility, and you cannot include everybody as in the plant-based world 100% because not everybody will respond the same. Not everybody has the same backgrounds. So what I do is I do believe that plant-based, like mostly plants, right, is the best way to eat, but it doesn't mean that you cannot add on your animal protein from one or two ways.
Yeah.
Lifestyle medicine it prefers
Mm-hmm.
100%
And you know
plant-based.
what? Right now,
Mhm.
I keep on nodding my head. That means I agree with you. And I seldom hear these words because I have to pay someone just to listen to this kind of discussion. And as we're talking right now, we're not even done yet, but I already have, something going on in my mind that we need to have this panel discussion with other cancer survivors or cancer warriors about lifestyle medicine because here at FACC, we are advocating cancer awareness. But the
Correct.
most important thing on cancer advocacy and cancer awareness is, of course, your lifestyle, right? Your health. And I also read it from your bio and some other informations. Before we sit down here, I Googled something and I also learned something from you online. That's what we do now. We search. We search
Yes.
each other's name. Why do you think it's important to focus more on not just on lifespan, but also on our health span?
Yes. Yes, I love that word. Exactly. It's about health span. Doesn't matter if we're going to live 120 years, Josie, but we're going to live them miserable and not and bedridden. So better to live 90, 95, but in our maximum vitality. That's the message, right? So I can give you a lot of, I can tell you, try not to have a fracture of your hip. And I promise you that you, for sure, you're going to have an 8 extra years of life in your pocket. Fantastic. But if you avoid to move, not to have a fracture, and
Yeah.
you become overweight or you continue smoking, then who cares? You're still going to have a miserable life that is going to be exposed to other chronic diseases that might not going to finish in death, but is going to finish in a lot of illnesses that is not going to give you vitality and is not going to allow you to live this life how we all want to live them. And it's like enjoying every moment like it's a unique moment.
That's
So,
right.
so that's what health span is, instead of talking about the number of years that we want to live.
It's the quality of life of living in
Absolutely.
this world. Now,
Correct.
cancer prevention is very powerful in the fight against cancer. And as a doctor, is it true that up to 40%, of cancers can actually be prevented?
Correct. Correct. So it is very important. That comes education. That's exactly when education plays a very important role in the community, right? Cancer is something that is always, it creates fear between all of us. This is something that we say, something that I don't want to have is cancer. And cancer today has been seen like one of the chronic diseases that it can be preventable until a certain extent. Let's say there is modifiable factors and there is non-modifiable factors. Which ones are the non-modifiable factors?
Mhm.
Aging.
By the
Aging
way,
is
in your family, do you have like a history of cancer?
genetics, exactly, exactly. That's a non-modifiable. And then, of course, there is some exposures that you might not going to be able to avoid, right? Let's say the radiation from the sun that is getting worse, the ozone layers that we might not going to be able. But let's say this can be modifiable relatively because we can put sunscreen.
Mm-hmm.
There is the modifiable ones, and is related directly with our lifestyle. And this is when lifestyle medicine plays a very important role, because it is how these 6 pillars can give you a very good environment
Mm-hmm.
to
Mm-hmm.
avoid
That's
that.
right.
See, that is 40% of the cancers can be avoided with lifestyle changes. So why not?
Yeah.
Now, you
Can
don't
you
have
walk us through with these 6 pillars that you are talking about? Can you tell us something about this?
Correct. So the 6 pillars are in nutrition. So it's the way how you eat, and it goes in depth. It goes to how much plants you eat a day, how much diversity of those plants you eat a day. It goes into the macronutrients, how much
Mm-hmm.
fats, and from the
So
fats,
first,
which ones.
nutrition. Okay.
Exactly. And then it comes the movement. So we call it movement. We don't call
Movement.
it exercise. It's about movement. It's reminding your body that you're alive, not sitting down in a chair the whole day because it's going to think that you're dying slowly. The third one is stress management, because it
Stress.
is a
Oh,
big,
that's very important.
it is, and it's a drive, it's because it drives cortisol high. Cortisol is a high inflammatory hormone, but it's a very important hormone. We will die without cortisol. So stress is a survival mechanism, but chronic stress is called toxic stress. And that's what we need people to learn. Again, it goes in depth. You have to know exactly where we put the line of this is a healthy stress versus this is a chronic stress, and how much of that chronic stress you can manipulate.
Mm-hmm.
Our fourth pillar is sleep. So sleep is
Sleep. Oh, I need
very
that.
important. It's recovery. It's where all your cells have a rest and recover, and they will slow down for to be ready for next day. If you
Mm-hmm.
are always you don't give recovery to your cells will age faster. Your cells
Oh.
will go wrong and
Mm-hmm.
mutate easier, and this is when we're exposed
Mm-hmm.
to this
There's a
chronic disease,
warning sign for me.
including cancer. So sleep is essential, and we're getting there. Before it
Mhm.
was undermined.
So nutrition, movement, stress, and sleep.
Sleep, and then avoiding risky substances, and that includes anything that is tobacco and
Mhm.
alcohol. And I add on as well some behaviors. There is some risky behaviors what we can go into the physiology behind what gives us pleasure, the whole dopamine pathway, which is always looking for pleasure, but that can be somehow unhealthy. So I will add on to risky substances also risky behaviors. It can be like is the only way how you can manage your stress is through being a shopaholic, for example, or gambling. So all these extra behaviors might be part of that same kind of addicted kind of a personality that we can manage. We can learn how to avert that dopamine pathway. And our last sixth pillar, which is a beautiful pillar, which is community, mindful, like meaningful connections.
That's right.
And
Healthy relationship.
healthy relationships and something that gives you back, and it's a bi-directional kind of
That
relationship.
motivates you. That's good for your emotions and your behavior.
Yes, and you can actually, it has been proven. I love all the science that is behind that, how your heart produces like a wave that it can go as far as 5 feet and the other person can feel it. So this is when you are like with someone and you feel, oh, you're vibrating a little bit
That's
low
right.
today.
It's like good
And all
vibes,
these things.
positive vibes. It's
Absolutely.
good
And
for
this
your
is no
peace of mind.
mysticism. It's not mysticism. There is a lot of science behind.
That's
So
right.
that community. So all this is backed up by a beautiful study. And I have to tell you, this study is gorgeous. It's called the Harvard study. They did a study from like 40 years. They took these men, all graduated from Harvard, and they took it like the same thing, like men, white, graduated from Harvard, and they do it just to create no bias. And they graduated from the same type of careers. And Harvard University has a lot of clubs in different cities. So they start following this group of men for years, and especially when they were going to the clubs and they were interacting and having meaningful relationships and whatever, playing cards, playing bridge, doing trips together. And they noticed that the men that lived the longer were the men that maintained those connections. That's called the Harvard story, and it's study. And it's beautiful because it shows us that if I have to pick one factor in longevity, including health span, will be the connection that we have. Community is exactly what you are doing with this channel. With this radio, is what you're creating is community. With your fundraising, what you're creating is community service. That's part of our pillars. This is lifestyle medicine, Josie.
That's right. So, what are the biggest, like things people can do to lower their cancer risk?
Okay, so we can go obviously from just superficially speaking about it all the way to in depth, right? So I think the one and most important point is education, knowing. And as much as social media could be very beneficial, it can create a lot of noise and can mislead you.
And
that can be
confusion.
misinformation. So one thing that it is very important is there is a way to you be healthy with the simple things that life gives you every day. You don't have to buy this last supplement biohackers just put in the market to create the perfect environment in your body. No, it's not true. If you know your body, and the first thing you know is, am I, and a doctor can do this, a nurse can do this, am I at risk of any chronic disease? And when I talk chronic disease, I include cancer there, because this is what lifestyle medicine say, right? Our chronic diseases, especially those cancers that it can be avoided with lifestyle medicine, which let me just mention them right now, mainly are lung cancer, breast cancer, endometrial cancer, bladder cancer, kidney cancer, colon cancer, and esophageal and mouth oral cancer. Those are the main cancers that are highly related to lifestyle choices, right? Melanoma, let's put it there too, skin cancer. So the first thing is you educate yourself. Am I at risk of any of these cancers? Because if I am, I might be able to make some life changes. And what can I do to make those life changes? At the end is the same, right? If I don't smoke, I am already protecting myself against all of them. So that's one thing that we know we can do. Now, if I'm smoking, this is one thing that I have to approach. And there is there is treatment for that. There is a process. There is many of us doctors that we're trained to how to help you to get rid of that smoking addiction, of that nicotine addiction. Am I overweight? Am I obese? There is obesity and being overweight. It's not anymore. We don't judge anymore. This is a chronic disease. It's a metabolic disease.
Especially in America.
Especially in America. And yes, another chat we can have about the food industry. But we're there, and what we can do is like, it is possible, is we can reverse it. We can put you back into your normal weight. And it's not about the old-fashioned eat less and do a lot of exercise. No, every person is an individual. With the obesity and with the overweight comes other things. How is my sugar? How is my blood pressure? How are my other hormones? How is my thyroid doing? How is my lipid profile? How is my cholesterol? Understanding the cholesterol, how some people has the tendency to have high cholesterol and they eat perfect. So maybe is this more familial?
Genetics.
More familial, what can I do? And so different things that we can first educate. These are the 6 pillars of lifestyle medicine. If you apply into your life, you already start doing prevention. But 2, you have to individualize those pillars. And to individualize those pillars, what is it that makes me happy? Example, in a community, what kind of things I can do? I don't go to the Harvard Club. I get it. Maybe you could volunteer. That could be one thing that is related to community. What can I do for stress? Like you were saying, I don't have time. Well, you know what, Josie, maybe at nighttime, just give yourself 5 minutes, sitting down in your bed and do breath work just for 5 minutes. You are going to start totally changing your stress. You're going to reset your autonomic system, and you're going to not only sleep better. So here you go, one of the pillars, but 2, your stress will be reduced. So those are the little details that now Josie knows. I know the 6 pillars. Now let me go to the doctor, to my nurse, and figure it out what's happening with me. How is my lipid profile, my glucose, my blood pressure? And a doctor that pays attention to you will ask little details about how stressed you are, how do you sleep, every little detail. And then you go, okay, Josie, from everything that we can get, all the data we can gather from you, now we're going to put together a nice program for each pillar that you should do, like the stress. Let's do breath work.
Why is something like, you mentioned about stress? Why is something like stress management just as important as, quitting smoking or eating healthy?
Correct. So stress, again, is directly related to your autonomic system. So your autonomic system is divided in sympathetic and parasympathetic. The sympathetic is the fight or flight, right? It's been there for survival. Is what they say is what we call the caveman used to have the sympathetic to run away from the lion. But we don't have to run away from the lions anymore.
But Doc, let me ask you, is there also like a good stress? Because if you're enjoying something, even though you're tired and stressed, you're enjoying it. It's like your passion. Is that stress?
Well, if it's giving you pleasure, maybe it's not a stress. It's just that you're putting an extra energy on what you're doing. Stress is something that it's all your sympathetic. So you feel your heart rate going up. You feel a little bit flushed. You might feel a little bit trembling. You are alert. Everything is that some people sweat. That's a stress. And I'm going to give you an example of a good stress that you shouldn't be lasting longer. It's, for example, you need to write an exam, and it's a very important exam. So you are stressed, and you need that stress to sit down and concentrate and pay attention, because if you're not stressed, you're going to get tired, you're going to get bored, you're going to be yawning, and then you're going to fall asleep during the exam. No, you need stress, but that stress should pass once the exam is done, right? If you need to run a marathon, you need stress. You need to put your body in a very stress sympathetic kind of way. But once you finish the marathon, should go into the parasympathetic, which is the relaxation. So what is happening with today's stress? We get stressed for everything. We get stressed for money. We get stressed because what we watch in social media. And so our
reading other people's posts on social media gives us stress.
Yes, and you feel it, right? You feel how that heat goes up into your head, and you go, And that is all sympathetic, but your body doesn't know better. Your body thinks that you are in a survival mode. So it puts you into that state, but if as much as you continue thinking about that post, your body is not gonna make you go into the calming state of parasympathetic. So that's when and the cortisol start racing, and all this is like adrenaline and cortisol, and all your body is in a high metabolic state, like like really like pounding. But if it goes long time, it is highly inflammatory, and each of your organs start suffering, like they are in a flame.
That's right.
That's what we call chronic stress, toxic stress, and it's a very important factor for cancer. We know that the emotions are the functional doctors are huge on that. It's like, why so much stress that is putting you at risk of all these cells to mutate and become abnormal and create a tumor
To activate, yeah.
and to
So
activate.
does the food, we eat affect our chances of getting cancer?
Well, that's one of our number one pillars, right? The one that we really approach. So there is one important thing, and I guess I'm just repeating myself, but it's what we've been exposed, especially since 1960s, is that after all the industrialization and all the processed food came on the market, and the idea behind the processed food was not a bad idea. It was about feeding more people, but once the processed food came in the market, and especially the fast food, all this is not nutritious, and all this has been highly manipulated. All this is what is making our body to react and to say, this is not what Mother Nature put in our system. This is not what is supposed to happen. So we start creating these new kind of diseases. One example is obesity. So we have the processed food. We have also a lot of environmental exposures, right? So not only the CO2 from the pollution of the cars, but also how much things are in that new food, all the fertilizers that have been used. Our soil is highly depleted of a lot of nutrients. So even if we are eating kale, it's not the same kale that we were eating in 1940s.
That's right.
Unfortunately, even if we try to do it well, we still are like in deficit of a lot of these nutrients. So what is happening with cancer is if you expose those cells to no nutrients or the wrong nutrients and to exposure of certain substances that the body is not used to it, again, you make them. It's all about the tendency to mutate. So you can make a mutation of all of those cells. They can just grow wrong. That's what it is, growing wrong. So this is when the tumors are produced. Now, I wanted to say this, which is important because we're just talking about prevention. But the same way how cancer kind of came into our world in the 20th century, because we wouldn't see it before, for many reasons, because of lifespan, because of the exposure to other
chemicals, environment.
Because environment, we also have modern medicine, which is able to detect cancer a little earlier. So that's why all these plays a role. But despite that, today we have a lot of surviving. And
we have so many survivors.
We have to talk about the positive things too. So we have the prevention side, without doubt. But we also have, once you are in the process of surviving a cancer or through treatment, all these lifestyle choices will make a difference in how you respond to that treatment. And if you're a survivor, and all the lifestyle choices that you make based on lifestyle medicine will dictate if you might just going to repeat another cancer or being exposed to a second cancer. So it is very important that lifestyle medicine doesn't stop into the prevention side, but it helps through the process of getting better and responding and decreasing mortality in cancer in general.
So let me ask you this. Can people going through cancer treatment, still benefit from exercise or doing some movements?
And yes, and absolutely. And there is a lot of science behind, a lot of studies showing how you respond better to chemo, you respond better to radiotherapy when you can treat your stress, when you can increase your physical activity, because exercise is anti-inflammatory.
So how
When
do you
you
stay active, even when you are tired or sick?
Correct. So you always individualize what the person needs. You don't need a person that he just came out of chemotherapy and is absolutely fatigued. You don't want to ask him to go and run for a mile.
Mm-hmm.
Many people understand that individualization. This is why I came to the 6 pillars have to be individualized. Your food, the way how you move. So that movement is very individualized to this person. We will take in account what's your energy. How do I increase your stamina? Let me
Mm-hmm.
just try to give you this food before and this food after. I want you to sleep 10 hours tonight. So tomorrow morning, we're going to do certain exercises very specific on the chair. So I don't make you stand up. We're going to different things. And the exercises there is a repertoire of exercises. There is a menu that we can take from, right? From resistance exercises, a little
Mm-hmm.
bit of cardiovascular, flexibility, coordination. We can do a lot of, it's about movement.
Mm-hmm.
We can, maybe that day says,
Simple
no,
exercise.
I don't want to move. So you know what? Let me just take you in a wheelchair for a walk in the park. Doesn't matter. So at least you're there in the movement of nature. So very individualized. And those days that they are active, because many people who that is going right now through chemo or radiotherapy have days that they are very active. They are very full of energy. So okay, I want you to make a little extra effort today, and we're going to do a good class on this. And that has to be paired with a nutrition. The nutrition is essential, mainly a nutrition that is very rich in anti-inflammatory things, in antioxidants. So that and people absolutely, without doubt, if they feel it, your body feels it. So that's important for the cancer passing through and the survivors to keep in mind how lifestyle medicine, it is the way for them to maintain a life that it is sustainable.
Yeah. So, what are some of the small things, that people can do every day to lower stress and, of course, to avoid some of these inflammations or chronic disease?
So if we only going to focus in stress, because life is stressful, and I agree with you, it might be one of the pillars that is the most complicated. And you talk about time. It doesn't require a lot of time, but it does require habits. So everything starts in your mind and how you perceive things that are in front of you. Yes,
Hmm.
there is things that are that
Yes.
are
I really
stressful.
believe that everything, starts in your mind.
Everything starts in your mind, and there is some things that are not easy. Like I'm going to tell you an example. If I'm an ER doctor and I see trauma every day that are coming to my emergency room, and I tell you, come on, everything is perspective. No, of course, this person is going to be stressed, taking care of this trauma non-stop. But at least I need this person to be aware that once his shift finishes, the next 12 hours or 24 hours before he has to go back to the emergency room should be absolute well-being, quietness, stress, sleeping well, good food, calming moments. Maybe it's a person that I would ask to take vacations more often where they can totally disconnect. So again, very individualized, but time can be an issue because it means that for you to treat stress, you have to take time for yourself. So it starts with you have to prioritize yourself and then understand that everything is perspective. And whatever we cannot modify, maybe we can create an innovative way that you can take care of yourself. What's the techniques? Many techniques. We have many techniques. At the end, there is many coaches that it can arrive to what gives pleasure to Josie. Josie said, I love to go and swim in the ocean. And I said, okay, Josie, we're going to make a habit. At what time you wake up? I wake up at 6. What if you wake up 20 minutes earlier and maybe you have enough time to go and swim for 20 minutes, go back home, get ready, and go to work. So it's about that and creating the habit. And the habit creates is a process. And many coaches are trained for that, how to create a habit. There is a small habits, very easy, like my lime water in the morning. I think I created that habit 10 years ago.
Why
I
are you
love
using lime? Why not lemon?
Because I prefer lime taste, but it works with lemon too. It's
Lemon
about the
is too
taste, right? It's
acidic.
more acidic just to counteract the pH in your stomach. So it kind of makes it better and warm because it's the temperature of your body. So it kind of opens your gastrointestinal system after being not receiving any food or water for more than 8 hours. So that's and I do like it. I'm very sensitive in my gastrointestinal system. So since I did the habit, I actually got used to it and I need it. And even when I'm traveling, I'm always looking for where is the supermarket to buy my limes. I have to use lemons when there is no limes around.
Yeah.
But habits and techniques and exploring and being curious, I have in my metabolic health clinic that I have here in Boca Raton, I have a lot of patients. And when we talk about stress, sometimes I go with them to this MBSR, which is like a mindfulness kind of systems to decrease stress that is science backed. And so I find most of the yoga teachers, they know how to do it. And I said, let's go together. And we explore that possibility of doing it together. And they like it because some people is like, I don't know how to meditate. I don't feel like it. But it's just being exposed. Once you're exposed, you didn't like it, doesn't matter. There is other options.
That's
An
right.
example, what I told you, breath work, it's very simple. It's just about paying attention how you're breathing in and out, controlling that breath. And it takes 5 minutes and you are totally resetting your sympathetic system to a parasympathetic state that is going to put you in a relaxation state. So you can manipulate that. You can.
Yes. We have few minutes left. Is lifestyle medicine covered now by insurance?
Unfortunately, no, and I think it should because nothing that is preventive is covered by insurance. There is a lot of kind of loops that we can jump. Lifestyle medicine really wants everybody to be able to afford lifestyle medicine. So what they do is people who already have some chronic diseases, they are candidates to be part of these programs. So many in your own community, you can ask your primary doctor, is there any lifestyle medicine center around here? And the way how the primary doctors are kind of recovering the money because it requires a lot of time. This is not a 10 minutes visit. This is at least an hour. So there is something called shared appointments, which is very interesting. And it actually has been proven that it helps a lot. So 10 patients will be put together. And especially if they have the same issues. An example is diabetes type 2. So if I have 10 patients with the same issue, diabetic type 2, we can get together, sit down and have a conversation about the 6 pillars and everybody's goals and how far we're going, what's the obstacles, how far their things has changing in their labs, how their latest sugars, the latest hemoglobin A1C, all this. So that creates community. And that's 10 patients on the same time that it will receive an hour of a doctor. And it's nothing super private that you are producing right there. And it has been proven that it works and it's a treatment. So share with shared appointments, some insurance might gonna pay, especially because these doctors can kind of charge the insurance as one appointment for that person that has this specific disease. So there is ways to see if a lifestyle medicine doctor, absolutely. Many doctors just do the regular visits, but they have a mind of lifestyle medicine. So I have friends that they just be a primary doctor and they will approach you, but they will ask you the 6 pillars and they will give you some anticipatory guidance based on each pillar. It might not gonna go in depth like I do. I include the nutritionist always. I include the fitness coach always. I have a behavioral therapist who takes care and he has all these tools for stress. I have a sleep specialist, which is a neurologist who tells me how you're sleeping, sleep apnea, everything. So we're a team. It's a big team, but the insurance doesn't recognize any of these things. So unfortunately, right now, the way how I am practicing is pretty private and is not afforded by everybody. But in the future, it has to be something that it has to be covered because this is going to decrease the amount of money that the system is putting, that the government is putting in the health system. But it's a sick system. It's not a healthy system. If we do prevention, we're going to start having less packed hospitals, less packed emergency room, less packed oncological centers. and more vitality in the community. People will be happier. So I think that's the medicine of the future. The simple medicine that it was basically nature made should be the medicine of the future, and that should be recognized by the insurance and the government.
Okay. So it's very interesting, we need to have more lifestyle doctors, I guess. And I'm glad that you choose this kind of path because it's very important. Like you motivate me listening to you right now. And I was like, wow, I know I read a lot of stuff on the internet, you know what I'm saying, on social media. You take care, self-care, whatever it is, mindfulness. But once you talk to a doctor like you, coming from traditional medicine, and then you decided this is it. This is what we should do because you can just, it's easy to get money from people, right? But sometimes you have to make a difference. It's, you have to have an impact with your patient.
Absolutely. And the answer is there. It's just we don't know, and the pharmaceutical companies and the insurance companies are not allowing us just to put this real education out there.
Yes.
So we educate our patients, we motivate our patients, we tell our patients that sometimes it's not easy and sometimes we go back in time. Sometimes I made someone lose 20 pounds and in 6 months they put it back. Doesn't matter. We go back again. At least you have the education and life happens. But it has to be sustainable. And that's what it is important. Once you include it in you, and it's small steps of those habits based on those 6 pillars that you can include in your life. And that's how you're going to create longevity, vitality, and health span.
By the way, Doc, you have your own podcast, right?
I do.
Where can we see you?
Double Down with Dr. D. So Double Down and then Dr. D as Delta. And I talk a lot, and I have a lot of guests about all these topics, a lot about thyroid disease, about sexual health, about menopause, perimenopause, nutrition, fitness. So I invite everybody here. It's in English, but I invite everybody.
You have it on YouTube.
I have it in YouTube. I have it in Spotify. I have it in Apple Podcast.
Oh, that's nice. So anyway, we hope to have you again, for, I'm thinking to have like a panel discussion with some of these cancer survivors or anybody that would like to get to know about lifestyle medicine. Thank you so much, Doc. And lastly, your message to everyone.
Oh, that's my pleasure. Thank you for this invitation. And my message is, self-advocate for yourself. Self-advocate. Go ahead and ask questions and learn the right stuff that is good for you, that is going to give you vitality. And not because you went already through the cancer journey, your life is less or you're losing any hope. For the contrary, maybe this is just a little slap on the cheek and say, you know what? I'm more in love with this life that I thought before I had this hiccup, and I'm going to invest in my vitality and my health span.
Okay. Thank you so much for being with us, Dr. Paula. And I'm going to check that podcast. And of course, we will contact you again. And thank you so much to all our viewers, listeners on PHLV Radio. Ito po si Josie Moralda Zayman from the Filipino American Cancer Care.
The Filipino American Cancer Care has just brought you On the Air with FACC, tributes and support to those impacted by cancer. On the Air with FACC, the Filipino American Cancer Care on PHLV Radio.